So let's talk contractions. It is one of the most hotly debated, talked about thing when it comes to being pregnant, because obviously everybody wants to know what they are going to feel like for them and how it is going to affect them.
Yeah, I think it's one of those things where people really want to manage their expectations, but it's not something that someone can really answer for you. I can't tell you what it's going to feel like for you to have your contractions, your surges when you're in labour. And you might not be able to tell your friend afterwards what it feels like, because it's really different for everyone.
Yeah, it really is, and it does depend on a lot of different factors. So let's kind of go through a few of those different things. So what do contractions feel like is probably one of the most Googled phrases, I should imagine. And it's really, really hard to tell because it is different for everyone.
It really is. And a lot of people will describe it as feeling like a mild sort of period pain. Some people will describe it as feeling like the most intense ever period pain. And some people feel them in entirely different places to where you might experience period pain.
And everybody will feel them in different places as well. So some people will really feel them here. Some people will feel them in their back. Some people will feel it in their side. Some people will feel them in their legs as well. They really do differ depending on each person, but we can give you a little bit of a breakdown of how they felt for us. So for me personally, I have had 3 births and each of them felt very, very different. My first birth, they were very, very intense. There was a lot of feelings, but I spent the majority, in fact, the whole of my first pregnancy and labour petrified and scared. So I know during them contractions, I was very tense. I was like this. I'd feel a contraction come in, and rather than breathing into it and letting it happen, I would grab my birth partner or grab something and tense up. And so they hurt, they were painful, but I had nothing in my arsenal to kind of help deal with that pain. Second time round, I had done hypnobirthing, so they felt really different. Now, nothing different was happening. I still birthed in the same way. However, the way that I dealt with them was very different in the fact that I did relax into them. So for me, they started off as real mild pains. Like I spent the first, 4 hours like going, oh, it felt a bit like indigestion, I suppose, is how I'd best describe that. And then they started to ramp up and they got more intense. But again, at no point were they really felt like first time round. They were just period pains. There were squeezes. It was obvious that my muscles were doing something. And then third time round, they didn't hurt. There was no pain there. They were really, really comfortable. Up until the point where I hit transition, and then I felt them in my legs a lot that time. But again, they were more like period-like pains, but like it's really, even 5 minutes after giving birth, you can't describe what they felt like. It's really, really difficult. But I would say period-like, they were sensations of movement, things happening. And third time round, breathing. Breathing when you're having these pains is really, really amazing. Like contractions, surges, they don't have to be like they were for me first time round, because second, third, I wasn't tense. So they did feel a lot different because of the way I behaved around them.
And I have kind of got a similar story, really. First time round for me, I felt them mostly in my back, actually. So for me, it was in my back, in my hips, along my thighs. And that started off with me just thinking I had a bit of backache that happened to be happening at the same time as my induction. But little did I know that was how I was going to experience surges. And I had been expecting them to feel like period pains. And that's just not how I experienced it. For me, I very much like Jade was tensing up. I had absolutely nothing in my toolkit to help keep me calm. I knew nothing of breathing techniques.
Nothing of birth.
Nothing of birth whatsoever. I did instinctively sort of move and shake and shuffle, and I knew to be upright, but that was where my knowledge ended. I really panicked throughout. I was very tense and I found it very painful. And in the end, I opted to have an epidural. And then in my second labour, I felt them very similarly. My baby was in a completely different position, but the surges felt very similar to me. Again, in the thighs, the back, the hips. And this time, with my breathing techniques, having my environment all set up nice and dark to promote my hormones, it felt absolutely nothing like the first time. The sensations were simply in the same areas of my body, but there was no pain associated with them this time. And the only pain that came was towards the end when my son's head actually started exiting my vagina, which I was able to feel that. It wasn't a tickle, yeah. But yeah, up until that point, I thought we were super early on, and it was simply just having that toolkit of things to get me through it, and my body just being relaxed enough to get on with what it was doing.
So let's talk you through a little bit about what are contractions. You know, we know that they're going to help get our baby out. We know they start, and that is labour. But what actually is happening there? What are our muscles doing?
Now, if you don't know this already, the uterus is a muscle. It's made up of a couple of different layers that are each kind of doing their own job. They've got horizontal muscles, they've got vertical muscles, and those two work together to get your baby out. And what contractions are doing is your uterus squeezing, and what will happen to your uterus is that each contraction will make it reduce in size until finally, when the baby comes out, it's very small. So there's no room for your baby anymore, and that's how it comes out into the world. So when you start off labour, your uterus gets smaller and smaller and smaller, and by the time your baby's been born, it's already reduced in size massively from what it was when you were heavily pregnant, and it's already kind of started going back to normal size.
And it really is amazing because those muscles, they don't need you to think them to work, but they do need you to give them some optimal conditions to allow them to work in a way that is conducive to a positive labour and to not feeling from the first contraction like it's awful. We see in the movies a lot of people, their first contraction they go, and actually, it's not the case. Most people's first contractions, if you're just nice and relaxed and you feel it, they just need to be a, ooh.
Is that something?
Maybe? Nah, definitely not in labour yet. And that is how things can actually be. But we just need to give it, like I say, this environment in where it can work as it knows how to.
The thing that's responsible for your uterus contracting is oxytocin. So the more oxytocin you have, the more your surges will happen, and your surges throughout your labour will get longer and stronger, ready to push that baby out at the end. So get your oxytocin flowing and help your surges along.
So make sure you subscribe to our channel if you don't know much about oxytocin at the moment, because we will be doing an oxytocin video, and so that will help you learn a little bit about how it is and how to kind of work with it.
So what's going to do the biggest thing to help your uterus to feel nice and comfortable, your surges to be manageable, and for your body to just crack on doing what it's meant to do, is staying nice and relaxed, because our muscles can work better when they're not full of tension, when they've got plenty of oxygen. So let us give you 3 tips to help your surges feel nice and comfortable for you.
Tip number 1, breathe. Okay, I know that sounds really simple, but knowing breathing exercises will help you take in more oxygenated blood, will help you be more relaxed, and that will help your uterus to do her thing. Long, steady breaths will be much more effective for helping your uterus, as opposed to what we see on the TV, which is like, I'm out of breath doing that for like 5 seconds, let alone doing that for long periods of time. So long, steady breaths full of beautiful oxygen will really, really help.
Learn those breathing techniques, practice them in pregnancy, and you'll really, really thank yourself later.
2, relax. Chill the fuck out. If you can feel tension in your body, we need to let it go, and you will feel tension everywhere. Often jaw, you'll see when someone's tense like this, really shut mouth and like things like this. So something we like to say, floppy face, floppy fanny, and try and remember that. If you can feel tension, this can be a birth partner job. So if you tell your birth partner, can you watch for tension in my body? And if they see tension, they can remind you. Maybe they can just little like pat on their back, or something to help that you find it really hard to hold tension in your body when you do this. That is so good for just helping you release that tension. So remember that, write down floppy face, floppy fanny.
Try and relax as much as you can, and when you think you've relaxed, relax a bit more. We're usually holding a bit more tension than what we thought, so try and make sure your birth partner's at hand to spot tension, and then really do what you can to just let it all go.
Relax, and then relax more. And number 3, movement. If you can feel yourself feeling like you're tense, if you're feeling worried, if things are getting quite painful, move. Maybe baby's in a funny position. Maybe that baby needs to shimmy down a little bit more, and that's why them contractions are feeling a little bit more intense. Move, shake, like literally get up, move, dance. Find yourself in more optimal positions for your baby.
And we don't need much space to move. It can literally be standing on the spot, swaying, bouncing. Listen to what your body wants and just sort of try and move quite instinctively. You might feel a bit funny, but I promise that it's going to help you to feel more comfortable. A lot of the time we feel like we are maybe trapped in one position whilst we're being monitored, or maybe we're in a waiting room and we're sat on a chair and we don't feel like we can move. But if you can make the effort to get yourself up and just be doing a little swaying, all of it's going to help. It takes your mind off it and it helps your body to get that baby down as well.
Absolutely. So I hope that has been helpful. As always, if you have enjoyed this video and you've found it of some use to you, please like it and subscribe for more content, which we will be bringing out weekly. And yeah, go and enjoy those contractions, because they do not have to be from the start. They can just be lovely and calm.